welcome to the Pause It podcast. I am Dr. Sam, and with me is Dr. Robert. Yay!
Hey, Sam, what's going on?
Oh, nothing much. How are you doing?
I'm excited to be here. This is the relaxing part of my week, so I'm just excited to hang out with you for an hour and talk about some pet stuff.
I know it's actually one of my favorite things too. I get to look forward to. I'm like, I get to talk to my friend. I get to take a break from everything else.
From
Just hang
children,
out.
from work, all the
Yeah,
things.
exactly. Well, did you have a good week this week?
Yeah, it was busy, but got off a busy weekend of 4 overnights, so I'm excited
Oh,
to get back on a normal schedule for a couple of days. But yeah, overall, it could have been a lot worse, so
yeah.
I'm grateful. So, yeah, what about you?
Oh yeah, I was traveling a bit and back, and then it's been one of those weeks where I keep looking at the phase of the moon to be like, is it a full moon? Because it's been crazy.
That's the thing. For people that don't know, it's a very real thing.
Oh,
Like,
it is a real thing. Yeah.
I, don't-
Full
I
moon.
I wish I could explain it. There has to be an underlying explanation for it, but I don't know what it is.
No, but it is a real thing. And I have definitely checked my phone and been like, yes, it is a
Yes.
full moon. And I can tell.
Yep. It's just like
That's
the
why I was really
crazy.
surprised this week it was not a full moon. So I'm like, then Mars is in retrograde or whatever. Because there's something else happening in the world. I actually don't know anything about that stuff. So I'm sorry if I totally said something wrong, um but no, I think but these types of weeks are kind of, while they're stressful sometimes and there are a lot to them, they are a lot of times what I feel like inspires what we talk about.
Yes, they do.
Yes,
I think you have a good one for us, I think, today based on something you
I
saw recently.
do. Yeah. So I had a case this week that was a first for me, because it was a cat with a disease I've seen in tons of dogs, but not ever a cat before. I don't know. I think with your population, this is probably different for you, but
Mhm.
so it is a disease called immune mediated hemolytic anemia. So we call it IMHA. I didn't want
Yep.
to just pop in and be like, oh, it says IMHA, but I don't explain what it is. And we will explain what it is, because it's definitely sounds like very overwhelming. Like, wait, say that again. So
Mhm.
immune mediated hemolytic anemia. And it's the first time I've ever had a cat with that before. And my understanding is that it's not very common with cats really to ever see that. And
Yeah.
that usually when you see it in a cat, there is, yes, they can have it primarily where you just it can just happen, but usually there's something else underlining it that's causing it to happen.
Mhm.
Um, and so, yeah, so I had this patient, um, and it was not at all what I was expecting. Sometimes we really get into these things where it's like, I hear the history and what I think it's going to be. And then he shows up and he's super pale,
Mhm.
panting, and I'm going, oh my gosh, I think he's anemic. I just looked at him and was like, this is weird. So we took his blood and lo and behold, he had a very, very, very low red blood cell count. And I was like, and it was very regenerative. So his body was trying to fix it, really, really trying to fix it. But it was very suggestive of something happening in his body that was destroying those cells, which is exactly what happens with immune mediated hemolytic anemia. So
Yeah, and I think that's the scary part for a lot of owners because it's a unique disease complex. It's a very expensive one to talk about, especially just cats don't ever get it. So it's cool that you had a case like that because again, you don't see them very often at all.
well, I was gonna
Um,
ask, because I feel like whenever you're in emergency, right,
mm,
your population is skewed, right, because you see
yeah,
feeds from all the different clinics around. They're crazy things that need a lot
mm,
of help, and this is one of those disease processes that is a crazy thing that needs a lot of help. So, have you
yeah.
seen a cat with IMHA before?
No, I'll say that's probably the only reason why is and one of my I'm sure my internists have, but I think probably the reason why is because the area that I live in, this disease is often transmitted by like tick-borne diseases in many
Hmm.
cases. Ticks, fortunately for the coast, aren't that big of a deal in many cases. So we don't see that many, as many I think cats probably if they're because they're so rare in the first place. It's like even cutting that percentage even in half
Right.
because there's not that many cats. But yeah, dogs wise, we see it all the time.
Oh
But
yeah.
yeah, not so much
Yeah.
cats. So that's kind of a cool case.
Yeah, and it's
Uh,
interesting too because I was very surprised because I mean his red blood cells were very, very low, and so he was anemic. For people who don't, I don't know, so a lot of people know that phrase. I don't think
yeah, I
that
feel like they're
think that's the
Yeah, I would
phrase
agree.
people understand, yeah, and so, like, this cat and there were some things, like, going back now and, like, knowing what's going on,
Mhm.
when I hear like, I'm like, "Oh, well, yeah, he was lethargic, he wasn't, like, eating as much, and he was kind of, like, not himself, like, very like, there was a lot of things happening, but the craziest thing was that, like, he jumped down off the bed and, like, laid on his side and just started panting. So I thought he had like a clot. Like I thought he,
Yeah.
you know what I mean? That's so automatic. Like I saw the video people,
Yeah.
they sent a video and I was like, bring him in now. Like
Yeah.
yes, bring him, you know? And then when I saw him, he's a saucy little cat. I'll tell you what. And so, so even with his very, very, very low red blood cells, he was putting up a fight. I mean, tell you
It's those
that.
9 lives, man. There's something to that as well because, like, I've seen cats at, like, 8% for various reasons, not necessarily IMHA, but for other reasons, and they still have more energy than any animal in that hospital, and they will when they're scared, like, there's boost of energy that comes from somewhere, and they are, feisty is a
I
nice
think
way
it's
to
the
put it.
adrenaline of being at the clinic. I mean, and it's
Oh,
a
yeah.
really real thing. Like people who are like, "Oh, my dog's been, limping all day, and then he came here, and now he can walk." It's like, well, yeah, because like adrenaline. I mean, that's like no
Yeah.
better pain medicine in the world.
Yep.
And so probably that's why this little kiddo was saucy as ever. And actually, yeah, because I hadn't had a case like this before, so I was like, well, I better. I mean, I know how to treat IMHA, but are the rules different in a cat? Like, I wasn't really sure. So I was trying to look it up and do my due diligence, and I was like, "You know what? I'm just gonna call an internist. That's what I'm gonna do." So I
Yeah.
called, and had a consult with an internist, and we kinda had a chat about things, and I was like, I mean, I know all the different things that I need to worry about, but I was like, this particular cat is a very, like, fancy purebred cat, and, the chances that so with cats, like well, okay, IMHA in general, right? A lot of times they need blood transfusions.
Yep.
And so my biggest worry was if this poor cat needs a transfusion, we have to be someplace where that can happen. But with cats, you have to be really, really careful. And with this particular breed, there's like a 50 to 60% chance that he was going to have the blood type that
It's rare.
was yes. And I was like, so there's no chance that someone around here has, B blood type for a cat. Like there's just not. And I don't even have a way to cross match them or do any of that. So I was like, it can't be here.
Yeah.
Like you got to go. And that was really ultimately the thing that sent him because I was like, I won't be able to do anything if we get to that point.
Mhm, and I think that's a really smart idea just in general because that's probably the biggest expense associated with these our pets essentially that have this. It's multiple transfusions in many cases. It can take a couple of days for the medications to work, and those transfusions are very expensive, and it's not easy to get. There's not many hospitals that have a storage of blood.
Mhm.
We have like our own facility at our hospital. And we're very fortunate that someone runs our transfusion units. But it's just very expensive and like it takes a lot of work to organize donors and to make sure the blood is safe to be given and to make sure it's like, thrown out when it's expired. So it's a big process, and there's only like I think even in our area there's only like three hospitals that do it out of like probably the 100 that are here.
Mhm.
So it's
Yeah, I don't doubt it. I mean, I'm lucky to be in between like 3 vet schools, so
oh nice,
you know what I mean? Like, you can get it definitely done at a vet school.
yeah,
But even they, like, I mean, they just have a donor on call for B type in a cat. You know what I mean?
oh,
So, they have 2 actually because
that's nice,
like yeah. So, yeah,
that's
but I
nice.
mean, I called ahead and I was like I'm gonna send you this cat, and they were like, "Yep, you can send the cat. It's fine." But sometimes you do have to call ahead and make sure because if I had sent them all the way to Purdue, 3 hours away, and they didn't have the ability to help her, she would have had to have gone a different 3 hours, you know what I mean?
Oh,
Which would have been 6 hours then at that point. And they wouldn't have been very happy with me,
oh
so,
yeah. And
you
also,
know.
just like a fun side note, if you're looking to save money on your pet and you have a very healthy young animal, consider making them a blood donor. I'll do a little plug for that right now. It's actually not a bad way to one save some money because they usually will credit your account at that hospital. So if something comes up in the future, it's nice to have a little bit of money knowing that ahead of time. But it's also just a really nice thing to do. You are literally saving other lives when you do it, just
Oh,
like
yeah.
people.
I didn't know
It's
that
just
about, though, like, getting discounts and stuff. I mean, I guess that would totally make sense, but I never knew that, so I just
yeah,
learned. Yeah,
Yep, so a
that's
lot of
very
times
cool.
so and don't if you have an angry cat, probably not the best candidate for it. But if you got a big happy lab and they got plenty of blood to give, you know, Gus, no,
Yeah, right.
there's
I know. I have to see if anybody needs his blood.
I don't know, but it's a really nice thing to do, and it actually goes a long way to helping out because there's a lot of hospitals that are starving for blood donors. So it's a huge thing. So consider it if you're looking to save some money with myBalto. Okay.
Now that's just become something that you say, right? Like every
Yep,
time you
exactly.
save money.
It's second nature now. So
This time
yeah,
it's by becoming a donor. Um,
yeah.
but yeah, so I guess like the important thing to talk about, and really it's a group of diseases. I mean,
Mhm.
that can happen. So your immune system can just go haywire, right? I mean,
Yep.
like it can happen for lots of different reasons. And in this case, this particular cat that I had, and like Robert said, it happens in dogs and all sorts of things, all sorts of breeds, usually like middle-aged and female, I think are a little higher,
Yeah,
right?
and if you're white and fluffy,
I was gonna say Shih Tzus are overrepresented, aren't they?
oh yeah, Shih Tzus,
Yeah.
Malteses, anything that's white and fluffy, like
Yeah, yeah, for sure.
and tiny.
And so and they, so those guys are the ones, where I feel like we see it the most, but the immune system in this case is attacking the red blood cells, but the immune system can attack your joints.
Yep.
The immune system can also attack your platelets. I mean, technically, your white blood cells too. I mean, really, that is pretty rare though. I don't think I've
Yep.
ever actually seen an immune mediated, like,
Not white blood cells necessarily, but sometimes it's going against the bone marrow. You'll see like
no. I mean, I know
um
it can. It's been a
yeah.
differential for me before, but it's never
Yes,
been
sorry.
but I've never actually seen it
Yes.
happen.
Yeah, it definitely it's I haven't seen it very often. Technically there's immune mediated disease in the brain as well. So there's a lot of different areas the body will freak out at.
Yeah.
And as you kind of mentioned, there's just a couple reasons that cause the body to flare up and start attacking the wrong thing. And unfortunately, it doesn't usually go well when it happens.
Hmm.
It's
Yeah.
it's usually yeah.
Oh yeah, I mean, animals get really, really sick, and I think the important thing to know though is given the time, it is treatable depending on the underlying reason. I will caveat that just slightly because
Yeah.
cancer is one of the reasons why it happens.
Yeah.
And so if that's the case, then obviously, you know, we're not going to have a favorable prognosis. But I will say, I think I've only ever had that be at one time.
It really depends, and, like, sometimes it can be not a terrible one because if you remove the cancer, it's not a problem. So, like, there's some, like, localized tumors that can cause that, and it's fine. You go
Mhm.
to surgery, you remove the tumor, and then you resolve the issue because it won't go away unless you remove the primary problem.
Right, yeah.
So that's the biggest thing for owners, and cancer is obviously one of the bigger ones, especially for the older dogs. But anything from like tick-borne diseases, those are really big ones. So have your pets on flea and tick medication because it's extremely important for this reason. I
Yeah.
guarantee one time getting IMHA, ITP, whatever, or any of those diseases that are autoimmune, you will spend more money in that one time than it would have cost you in many cases. Because like sometimes it can cost you like $5,000 for like multiple transfusions, hospitalizations, like it is better to be on preventatives ahead of time and prevent that cost because I guarantee it's cheaper.
Yeah.
It is
Well,
cheaper
it's
for
the
cancer.
same. I mean, truly, it's the same story with like heartworm disease. I know we're not
Yep.
talking about that right now, but it's like
No.
treating heartworm disease one time would have paid for your dog's all of their preventatives and
Yep.
then some.
Yep.
So, and also not to mention the damage that like heartworms do to the heart. So, like
Yeah.
so many things. But also too, I mean, I think it bears discussing, although I don't really want to like scare people, but technically drugs can cause IMHA. Like, there are certain
Yeah. Okay.
medications that are very common that we use all the time
Yeah.
and 99.999% of the time, no problem. But
Mhm.
every once in a while, you will get a drug mediated immune
Right.
problem. Sometimes it can even be vaccine related.
Yeah.
Um, Again, so rare that I hate to say that it is true and it should be said, but I don't want people being like, "Well, I'm never giving my dog a drug or getting a vaccine again." No, don't do that because the chance it's going to happen is very, very, very low. And the chance that they can get a preventable disease is much, much, much higher. So
Yes.
every time you do anything to your dog, and I tell people this all the time, everything's a choice. Everything's a medical decision and nothing is benign.
Yeah.
There's just not anything that's perfect. but we make decisions based on what we see most often, what's
Mhm.
most likely, and what is the biggest risk. Everything is risk benefit that we do all day, every day.
Mhm. No, I couldn't agree more, and it's funny because I actually saw my first, estrus, mediated, disease where the dog went into heat, and it developed, the platelet autoimmune disease, ironically enough, which
Oh, immune mediated thrombocytopenia.
yes, that one. Um, but yeah, it was, caused by dog going into heat. Happened, like, back when it was in August, and it happened again. It happens every time the dog goes into heat. I'm like, "Spay your dog." I'm
Spay
like
your dog.
yeah,
What?
so
Really?
yeah, so it's, it doesn't happen very often, but it can. So,
So
there is
there
a
you
reason
go.
to
I
spay your
mean,
pets.
it can happen just by letting
Just
nature take its course. But I mean, I can just say this. I mean, like, I myself have an immune mediated disease, and there's a entire possibility that it was like it happened. Like sometimes it can happen after pregnancy. You can have that.
yeah,
So
yep,
you know,
it's
but I wouldn't trade
hormones,
my.
man.
I know, and that's the thing is like, and I mean, like sometimes we also just don't know why it happens. You know what I mean? And so that also happens too. I mean, I would say that sometimes the immune system just goes haywire, and you know, then you have to deal with it. And I, knock on wood, have seen most of my patients do really, really well. Um, if you catch it and treat it aggressively and don't try to get them off meds too fast, or like take shortcuts in monitoring and things like that. You know what I mean? Like I've actually seen them do really, really well. I have had to transfer quite a few though to emergency for like further care. So to
Yeah,
see somebody like you, um, just to make sure that they got through that really acute, kind of more dangerous part, making sure that, if they need a blood transfusion, they can get it, or blood products, right? I mean, I think, I don't know, do you transfuse ITP? I mean, would you give them
sometimes we
well,
will.
yeah.
Sometimes if they like, especially if they need like a surgery. We've had a few dogs like it just bad timing where they need a surgery. They happen to have ITP,
Oh,
and it could like because unfortunately platelets don't last very long in your system for owners. Like they're very short lived. So like giving transfusions of platelets isn't super effective unless you have a need for it. Like you're going to surgery and you need it right now, or there's like a bleed that's happening that you can't stop, like a brain bleed or a lung, like a bleed in your lungs. Those are bad, obviously. But those are the ones like the only times we give like that. The medications we do to help get baby platelets into the system, and that helps. That way, you kind of get the workforce out there early, start them while they're young. But otherwise, that's the biggest thing is trying to provide the supportive care, and a lot of times for the medications that we use for them to kick in. It's just a time game, unfortunately, when they're really sick.
yeah, yeah. And every once in a while you get lucky when you catch them. I think that that's really where you either kind of need to go see somebody like Robert, or you can kind of initiate treatment with me. You know what I mean? I think it just depends on clinically how the patient is doing, because I think sometimes you'll see like either how anemic they are, how low their platelets are, and you're like, what? Like, how is there no spontaneous bleeding? Like, I don't understand how this is happening right now. You know what I
Right.
mean? And so, but I actually did have a patient one time that had the platelet one that you're just talking
Mhm.
about. And when I first saw him in the beginning of the day, he didn't have any bruising. He didn't have any, any sign of like spontaneous bleeding. But by the time he got to the referral clinic,
Yeah.
he did. So,
Really?
I
That's
mean, yeah, like it was literally, and it was probably that, like it was within 24 hours, but it wasn't like an hour.
sure.
You know what I mean?
Yeah.
It was a lot of back and forth. Like, should we go? Are we not going to go? Can we do it here? You know what I mean? It's
Yeah.
these things always are not as like, oh, you have this, go ahead. It was
Mhm.
also figuring out logistically and financially, is this something that we're going to commit to?
Yeah.
Um, and but yeah, I have had to be a pretty rewarding disease. The thing that I think is really interesting is, at least with IMHA, the idea of like what actually is the issue, that if pets don't survive, what it is that actually makes them survive or not. And it's a lot of times it's more so like clots, blood clots, really, that end up being the issue.
Yeah, I think that's number one, and the second one's finances. But yeah, like a lot of
Right.
times And just this is just with the red blood cell one, for the
Mhm.
most part. But
Oh, yeah, right. I guess that would be confusing because we're talking
oh,
about clotting and the one.
oh, it's okay.
Yeah.
No, no worries. But yeah,
My
it's
mind
like
is very much on IMHA right now just because I'm all. Oh, and by the way, it turns out they do think that cat does have a parasitic infection.
oh yeah, oh
Mhm.
cool. It's well, at least it's treatable, and that's kind of the nice thing. It's like a
Yeah.
treatable condition.
Yeah, because
But
he's a young and oh,
uh,
PS indoor only.
really, that's unlucky.
Yes. So just a reminder that indoor only animals can get parasites. Although they did bring in a foster kitty, so I think that's probably where it came from.
It's always the new ones causing problems, man.
Well, it's one
Uh,
of those things too. It is always a really good reminder of just like reminding people if you see a new kitten or just you're bringing a cat into a already established home,
mhm.
don't put them together right away. Make
Yeah,
sure that you really keep them separate until you've given them a really clean bill of health,
yeah,
made sure they don't have any ectoparasites, make sure like fleas, ticks, things like that,
right.
mites, just because it really isn't worth the health of your other pets, and it doesn't have to go poorly. It can go really, really well if everybody is disease free. But I can't tell you how many times really, really well intended people let a dog, a cat in or something like that from outside. They have ringworm, and then everybody's got ringworm, and now you've got ringworm, and you know what I mean? Like things like that happen. So it's like,
Mm.
just 2 weeks is not that long, you
It's
know,
really not. It's a
the
good
same
acclimation
amount of time
phase,
you have to keep the e-collar on. It's not that long. It's 2 weeks.
and they don't have the e-collar
We
on, which
can
is
do
probably
it.
the worst part. I know, right?
No, they don't have an e-collar on, you're just gonna keep them in a different room. But and if you don't have the space to do that, maybe if you have a friend or somebody that doesn't have a pet that would be willing to, like, help you sequester them or
Yeah,
whatever, just 'cause it really can. I mean, in this case, it might have ended this cat's life, except these people have insurance for their cat.
which is super helpful in these cases. Yeah, because I guess in my experience, the IMHA ones, the one that detect the red blood cells, they kind of put them into like thirds. I think most of the interns, like a third of them will do well, a third will relapse at some point, and like a third don't do well. But the ITP ones do great. The ones that attack your platelets, those do usually much better. But it's just a time thing for a lot of them, like time and money. If you can do it, it helps. But yeah, it's I feel bad for owners because it's scary because like you gotta put a lot of finances into it, and you don't know if your dog's gonna respond, when they're gonna respond, or your cat in this case.
Mhm,
So it's a tough disease.
mhm. Have you had a lot of experience with the polyarthritis, like the one that attacks the joints?
Yeah, I've had quite a bit with that one. Because they have that like characteristic like eggshell walking thing. And my colleague one day, he got me one day because the dog walked in. I was like, I can't figure out why this dog is lame. And he's like, oh, it's walking on eggshells. It's got IMPA. I was like, you're the worst. I was like, oh, that's the reason why. So so it's nice
You
to
know,
have colleagues.
it is funny, like, every once in a while, you're just like, "Oh my gosh, why didn't I see that?" You know what I
It's
mean?
like,
Like, because 'cause we're human, I mean, sometimes you're
yes.
just like but that's why I don't think I could ever work by myself. I really love and, like, appreciate being able to kind of be like, second set of eyes, "Can you look at this? Like, what am I missing here?" Or I call you and I'm like, "Hey, what do I do?"
It's really nice to have the environment, though. I think the veterinary community is usually pretty good about helping each other out, and especially but when are alone, that's why a lot of young vets don't wanna work alone when they first start because they're still learning and they have no one to bounce ideas off of, and I don't blame them. Like, it's
Oh,
scary to start
no,
off on
it
your own.
is. I think I remember the very first time I think I ever worked alone, I was like, I don't know anything. Like, I don't leave me alone. I shouldn't be alone with anybody.
I've forgotten everything.
I know. But I do think that those times do like they're like probably character building, and you have to just get through it yourself. But for the most part, I really do. I like appreciate the input because sometimes even just, you know, what works in your hands historically, like what you've done, and you've seen it
Mm,
at this point now, we've been practicing long enough that it's like I've seen a lot of these through like beginning, middle, end. Like I have an idea of how I expect this to go. But
yeah,
sometimes things don't like open up the textbook and go like, oh, I'm supposed to do this next. So I'm gonna do this next. So it is nice to have other doctors that are like, well, I use this and it works for me. And if so that's not working, maybe you try this. And it's like, oh yeah, that's great. And sometimes I don't know. I have no ego. I don't think I know everything. So
yeah.
I'm totally fine asking somebody else what their opinion is if things aren't
Yes,
going in the right direction.
and that's a lesson to all owners too. If you have a doctor that says they don't know, that's a good doctor,
Oh
because
yeah. Oh
it's
yeah.
a better doctor to say like, "Hey, I'm gonna find out for you," because
I was gonna say that's a good doctor. The better doctor goes, but I'm gonna look it up for
yeah, that's the
you.
better doctor, upgraded version, but honesty is very key in this environment, so,
Yeah.
um,
Well, and I think as a young vet, like when you're very, very first starting to work, you're so afraid of saying, I don't know, because you
yeah,
don't want to seem like you don't know because you're incompetent. And I
mhm,
think the best thing that you can realize at some point is nobody knows everything. Doesn't
no,
matter how smart you are, it doesn't matter how long you practiced, you're always going to come up against a head scratcher and you're always going to be like, I don't know. I don't, because it's, we see so many weird things and we're expected to do dentistry, internal medicine, eye doctor. Like, there's just no way. We're not specialists in all of those things. So, of course, we're going to get stumped sometimes.
yeah,
And the goal is to know when you don't know, where to look it up, and
yep,
who to ask.
yep. Couldn't agree more. I think those are, if you can learn those things coming out of school, you're in good shape.
Yeah, exactly, exactly. And then, every once in a while you just like get lucky that most things tend to get better. So, you know,
Spilling trade secrets, Sam.
I
Spilling
know,
trade secrets.
right?
Everybody's like, "They do what?" No,
Wait, what do you mean? No, but I'm just saying, you just give them a little loving care.
yep,
And they'll get better.
TLC means a lot. Yep,
Exactly.
TLC.
Um, and then so as far as the polyarthritis goes, um, I have only ever actually had one case of that, and it was
Mm,
following a TPLO.
really?
And the dog rejected her
Mm,
plate, had to have it removed, and then got immune mediated polyarthritis. I felt so bad for this poor little dog.
that's bad luck. Was the dog on antibiotics beforehand?
Oh goodness. She went to a specialist to do the TPLO, and it's the same one that we send. I mean, I've sent
Really?
droves of dogs. They are excellent.
Oh, I'm sure.
And they got just, every once in a while plates get infected, and that's what happened in this case. So I don't know if it was to the antibiotic because they had to keep her on the antibiotics until the bone healed to be able to remove the plate.
Okay.
And then she got, yeah, I mean, horrible.
That's yeah, that's always the worst because people worry about boats or plane or sorry, plates get infected all the time,
Mhm.
and most of the time it's fine, but
Right.
occasionally they do that come back out, and but to have a secondary disease from it, that's rough. That's
I know.
um,
And of course, you could probably just write the fact that like it's literally the nicest dog and the nicest people. Because it always seems like that's who that happens to. You know what I
that's like
mean?
the vicious triad of veterinary medicine. It's always super great owners, awesome pet, terrible disease that we can't fix.
Yeah, it is true.
Yeah.
Um, and like if their name is Lucky, it's just like, I
Stop
mean,
it.
don't
Stop
do it. Don't name your
Lucky.
dog Lucky.
Yeah, stop Lucky because
And
you're
I'm really
doing them for
sorry if your
failure.
dog is named Lucky. Lucky or Chance, don't do it.
Yeah, give them a fighting chance. Don't call them Lucky. All right. So it's bad, man.
Because Lucky's
It's like
almost
clockwork.
never lucky.
Yeah, it's like you're cursing them from the onset.
I know it kind of is. But so anyway, yeah, but I think that with those, the question that I've had come up is, do you vaccinate those again? Because I've heard with polyarthritis, it's not the same as the other ones. What's your thought on
I think most lean away from it just because they're like, why risk it? And they encourage their owners to be safe about because most of the time they're hopefully old enough where they had at least the first round, and they say, or check titers instead. That's a big thing that's happening now.
that?
Like, just make sure your titers are up, and then you kind of go from there. But yeah, I don't for that ones for sure. But I guess I haven't seen many like follow up for IMPA as much.
Yeah, I'm too much of a weenie. I would tell people no.
Yeah, I'll be like it's better safe than sorry. I'm like your dog will be fine without any
Yeah,
vaccine for a second. Like
yeah. I mean, I'm hard, like hard and fast. IMHA, IMTP. They don't get a vaccine ever again.
nope.
But I had read that the polyarthritis there isn't as big of a correlation, and I was like, still don't think I'd do it.
Still don't trust it.
I don't know. I just yeah, and in my experience, I've had the exact same experience where it's like they're all older, like middle-aged dogs that had a
Yeah.
very good vaccine history.
Yeah,
you know what I mean? So usually we'll just err on the side of like, don't take them to dog parks and,
agreed.
be smart of who they're around, but they have some immunity.
Mhm.
I don't know if it's worth reactivating that immune system.
But I agree. It's better safe than sorry, because otherwise, they're gonna come back at you afterwards like, "Why'd you vaccinate my dog? You knew this," and you're like, "Well, damn." So it happens. But fortunately, all three diseases are treated nearly the same.
Hmm.
Steroids, lots and lots of
Yeah,
steroids. They're
lots of
so nice.
steroids. So many steroids. And
Honestly.
then I usually like with ITP get them on a secondary,
Oh,
um,
nice.
like pretty quickly.
Okay.
I've had it. I mean, my few that I've had have all done really well
Oh, nice.
doing that way. Um, my most recent IMHA, same thing. They went to Purdue and they had them go on something right away. I've gone both ways with the IMHA, but
Yeah.
you know,
Yeah, I think I don't ever get to do that side of things as much because usually interns are very particular about which secondary drug they wanna use, and I do
yeah,
not like to make anyone mad, so I'm like, "I'm gonna start you on steroids, and you guys have fun.
you guys add the next thing.
You add the next one, I'll get them started, and you continue from there." Because everybody's and that's the thing about medicine, everybody's so particular about what they use.
What works in
It's
your
just
hands?
exactly what
What
you're
have you
comfortable
seen
with.
work? Yeah.
Mhm.
And I think that the owners just understanding the process too. Like when they
Yeah.
decide that they're going to come and they're gonna they're gonna go in it for the long haul, that you have to understand this isn't gonna be over in a couple of weeks. This is going to be like months worth of
Yeah.
coming back, checking to make sure that, as we're weaning down or once we're
Mhm.
safe to wean down, that, I mean, we're gonna go like really slow and do it like because what you don't want to do is be like, "Oh yeah, we're okay," and then have a relapse, and
Yeah.
then now it's harder. I feel like it's harder to get control of it again
Yeah, round 2
once
is
you've
always rough.
relapsed. Mhm.
Yeah.
No,
So
and I think it usually happens, unfortunately, like at the place where they're so close to the finish line that they're just like, I can like taste being off of pred. You know what I mean? And it's just
yeah.
like we're so close. So that's when I tell people, I'm like, don't give up now. Like this is
Yeah.
not the time to get sick of it because this is where this part's critical. And if they're
Yeah.
gonna relapse, this is the place where they're most likely to relapse. And so I guess that part you probably don't really deal with that much. I mean, you get them through the acute
Yeah.
phase, but then like it's people like me that are like,
Manage.
okay, come back in 4 days. We got to make sure that, when we change your meds that, things don't tank. And
Yeah.
so
Yeah, because being on steroids, there's so many side effects, and I feel bad for owners, honestly, because they make you pee more, they make you eat more, they make you drink more, it's, pant, it's like all these terrible, terrible side effects. It's a great drug, phenomenal, but it's a lot of side effects, and owners have to deal with all those, and it's easy for us as veterinarians to be like, "Yeah, stay on these meds forever," meanwhile, your dog's, like, having
you have to
accidents in the
like
house
put in a
because
dog door because like they have to go
yeah,
out every 5 seconds.
yeah, it's
It
crazy.
it is kind of funny though. Like I have definitely had patients that are so sensitive to steroids,
Mhm.
but I've had others that they're like, they're fine. I don't notice anything. So I'm like, is
That's
it
nice.
is it the owner or is it like, you know what I mean? Because like
Yeah,
I had one that, I mean, literally, like they were like, yeah, I mean, maybe she drank more, but she didn't really pee that much more, and she ate what she ate. She was fine. Like, you're like what? You're on like immune suppressive doses of bread, but okay, But I do find sometimes with steroids, like when they really need it, sometimes the side effects maybe aren't that bad.
yeah, I think that's true, like, same thing with transfusions, the dogs are really sick. I should mention transfusions are not benign. And we do get like they can have allergic reactions to them, and they need them. You don't have a choice, but it is good to know that you can have reactions to them. Some can be very bad reactions. It's very rare. I'll say our hospital does easily 20 to 30 transfusions a week, and the number of actual reactions is I don't know less than one, probably a month or so, if that. So like, it's very rare, but they can happen, and it's just to keep that in mind as we give these transfusions because they're not just some people just come back for like transfusions all the time because I think their pet needs them for chronic management, and we don't do that. So
Interesting. It's funny. You don't do dentals, I don't do transfusions. So I literally am like, tell me more. 'Cause I don't know. So what happened? I mean, I guess I don't know if we can even get into the nitty gritty of it, but like I'm curious, what does a blood transfusion reaction look like?
The mild ones would just be very similar to like allergic reactions. They'll get a higher
So
heart
like,
rate, or yeah, they might get some swelling in their
okay.
face. Usually a higher temperature. The bad ones could be more like anaphylaxis, where they can get like low blood pressure.
Mm.
But the really bad ones are like when they're tacos, which is like transfusion associated, kidney injury. What's that called? There's also like transfusion related lung injuries. Those are bad. Because when they have injuries related to like the transfusion itself, the lungs and kidney get messed up. So,
Yeah, gotcha.
yeah, those
Are
are
they
that's
treatable
nice.
at that point, or is it pretty much since they're so sick that they needed it anyway, they can't really fight through it?
It's really like that. The lung associated one is bad.
Yeah.
The ones I've seen with that one are pretty bad. There's not a
Mm.
lot of good options because usually they're having a hard time breathing. They need fluids, but they're overloaded. It's just
Yeah, there's no way to like really keep that apple cart from tipping.
yeah, like you need to like the owner needs to be really into anything because your dog just became like a $15,000 dog very quickly. And it's
Wow.
very expensive. So, but yeah, these are very, very, very,
Oh my gosh, I was
very
just gonna
rare.
say, so
Yeah,
rare.
yeah, it's like
I didn't even know because like honestly, I've had plenty of patients have to go and get transfusions at
mm,
places that do transfusions, which I do not. And so and I mean knock on wood, right? I don't hopefully I don't want to put anything out there, but like no, it's usually benefited them. I've never really
yeah.
had one that wasn't
They
benefited.
most of them they need it and they look and honestly I wish we could show owners like afterwards how much better they look. A lot of times their pets like really lethargic and all that and like 4 hours later after the transfusion, they're up bouncing around like I feel great and you're like, I fixed it. So
Yeah.
it's a good feeling to see them like back and moving about. And the cats that were really, really nice when they first came in turned into little spicy demons afterwards because they're like, I've got my power back and they're ready to take control again. So it's a cool thing to see them get better.
Yeah. Well, that's this particular cat, like, I thought for sure based on the, like, description of,
Mhm.
like, how he was doing at home, I was like, "Oh, well, this will be, like, the first time I can ever really touch him." Mm-mm. No.
Nope.
Nope, nope, nope. Despite his severe anemia, he found a way to be very saucy.
He's like, I'll deal with you.
I
Uh,
have to say that they described him as ghost pepper level spicy by the time he got to the next place, and I even gave him meds because I talked to the doctor
Interest.
before I
Yeah.
sent him, and she was like, "So, I mean, if you want to give this little dude some gabapentin before you send him, we'd really appreciate it." I was like, "Yeah, sure, no problem."
Yeah, why not?
And, it helped, but
Ghost level, ghost
ghost
pepper level
pepper
spicy.
level. Yeah, that was
That's pretty cool.
it was my favorite description of a cat's behavior that I've ever gotten. I was like, whoever wrote this is definitely my new favorite person."
Yeah, I feel like I use that more often now because I think it's very appropriate for many of our feline friends. Like,
Yeah, ghost pepper level spicy.
yep.
And he is a really cool cat, and his owners love him so much. So I am really glad that he's doing really well, and that they're figuring out the why, and that gives
Yeah.
him such a better chance of getting over it and then not relapsing, right? Because I mean, if
Mm.
there's a why and you fix it, you take that why
Mm.
away, it makes it a much better prognosis.
Yeah, 100%. So it can be treated, which is nice.
Yeah.
So just gotta look at your options and give it time.
Yeah. So the big takeaways: body does weird things. The immune system can go haywire, but we can fix it.
And we can prevent it more importantly.
Yes,
So
exactly.
so
Well,
in many cases. In many cases. So just get flea and tick preventive. At least do that.
yes, yes, exactly. It's a good PSA.
Yeah.
But otherwise, people can always email us. It was really fun last week getting to talk about what somebody had sent us at podcast at mybalto.com. So I would love to answer more questions for people anytime they have them.
Yep.
Podcast at mybalto.com.
Yep. And we went live with our app this last week. So sign up, start saving some money for your pets. And every time you buy something on our app, you're also helping save the lives of other pets.
Exactly.
Um,
And just think if something like this does happen to your pet and you do have a big pet bill, my Balto is here to help you pay for it. So there you go.
yep. So sign up early so you start earning some treats to save you some money long term. So that's it.
Absolutely. Well, this has been the Pause It podcast with Dr. Sam and Dr. Robert. Thanks everyone for listening.
Thanks, guys.